So if we have evidence-based practice that shows us over and over and over again that physical therapy doesn't work for knee pain, doesn't work for back pain, doesn't work for lateral epicondylitis, doesn't work for plantar fasciitis, whatever, and those studies are out there. If I'm the insurance company, I'm going to take those studies and say, hey, look, this stuff doesn't work. So when people do electrical stimulation, or when they do massage, or when they do exercise and they do modalities and whatever it is that these studies looked at that were unsuccessful in the treatment of these conditions, they can say, well, why are we paying for physical therapy if people aren't getting any better? So we're not going to pay for this. So whose fault is it that patients aren't getting better? Is it the insurance company's fault? No. Would you pay, if you had to take your own money out of your pocket, would you give it to people to go get treatment 2 to 3 times a week for 6 to 8 weeks for something that would go away by itself in 6 to 8 weeks? So we know that if we have idiopathic low back pain and we don't do anything for it for 6 weeks, most likely it will self-resolve. We also know that the typical treatment at a physical therapist is 2 to 3 times a week for 6 weeks, which means they could have just stayed at home and got the same results. So why would I take money out of my pocket to pay for somebody to go to physical therapy for 6 weeks when I know they can stay at home and do nothing and get the same results in 6 weeks? So whose fault is it? Is it the insurance company's fault that the patients aren't getting results? No. Is it the physical therapist's fault that the patients aren't getting results? Yeah. And whose fault is it that we don't know what we are doing? Whose fault is it that we are using modalities that have been proven over and over and over again to be ineffective? Whose fault is it that we're doing things that are actually more detrimental than beneficial, like stretching and massage and foam rolling and all of that stuff? Whose fault is that? Who put that in our head and told us, hey, you're a physical therapist, this is what you're expected to do, go do this? Who put that in our head? Did I graduate PT school and tell myself that's what I'm going to do? Nope. I was told that by the university, the college that I went to, the PT school that I went to, the rotations that I went on. So the problem, the root cause with poor reimbursement is not an insurance problem. The problem with poor reimbursement, the root cause, is not a physical therapist problem. It's an education problem. And now we get back to the university or the PT school and we have to ask ourselves, what is their purpose? Is their purpose to take students in from undergrad and turn them into elite clinicians in 3 years? No. Because one thing that I'll share with you in the Facebook Live is I don't think it should take 3 years to go to PT school, especially when you just wrapped up 4 years of undergrad. That is absolutely ludicrous. So do you think they're working on 3 years of clinical skills with you? Or do you think they're working on something else? And do you think that their whole purpose is to just get you to do something, like maybe pass boards? Okay, so the root cause of poor reimbursement isn't the insurance company. So we need to stop blaming insurance companies. We need to stop thinking that, well, I'll just go cash and screw the insurance companies, because now you're going to take your minimal skill set. So remember, PT school purpose is to turn you into a generalist that is average, that plays by the rules, that does what you're told and can pass boards. That's it. So you're a generalist with minimal skills. And now you're going to say, well, the problem is insurance companies, so I'll remove insurance and I'm going to take my minimal skill set as a generalist out and charge people $200 for a visit. Does that solve the problem? That doesn't solve the patient's problem. And that doesn't solve your problem, because now you're running a business, which, oh, by the way, PT school didn't teach you how to do that either. So now you're trying to run a business and charge people an exorbitant amount of money to do the same thing that they can pay the $30 copay to do somewhere else. But you think that you're going to be better and they'll want to see you because you're charging cash? That doesn't solve the problem. So I want to hear your thoughts on that when we get to Facebook Live. So there's one of the problems that we're going to talk about. Insurance lack of reimbursement, low reimbursement rates, Medicare dropping reimbursement, all that kind of stuff. And we're going to get to the root cause. We're also going to get to the root cause of autonomy. What do you think the root cause of your lack of autonomy is? What do you think the root cause of people thinking that physical therapy is just glorified massage or glorified personal trainer or glorified athletic trainer? Are they right? Why are they right? We'll talk about that. So we need to get to the root cause of that too, and then solve that root cause. So as we go through the Facebook Live, we're going to start knocking out, this is what is causing the problem down the road. And this is why in 2024, we're in a worse position than we were when I graduated from PT school in 2000. So over 24 years, our profession has got worse. We've added more crap to it. So we're going to go over what happens when we add more crap. Does that make us better clinicians, or does that make us look like a glorified personal trainer? Does that increase our reimbursement, or does that decrease our reimbursement? Does it increase our autonomy or decrease our autonomy? So over 24 years, have we put ourselves in a worse position with lower pay, less autonomy, less status, even though we're doctors, that people don't understand why we're doctors if we're just doing personal training or massage or chiropractic? Why are you a doctor? Okay.